Okie dokie. So what we want to think about is this idea that behaviour has been, until relatively recently, kind of thought of as a separate thing, very much by the veterinary profession, almost not involved with what we do. But actually, that doesn't make any sense. If you think about mammalian health, then it has two components to it. It has both a physical component and also an emotional component, a central nervous system brain component, which in humans we tend to refer to as mental health. In veterinary medicine, we tend to refer to as emotional health. So effects of disease in humans, there has been a lot of work done on this interplay. So looking at the effects of emotional or mental health and triggers of an emotional nature and the onset of physical disease. And that's been to do with both the effect of childhood on later physical health. If you're aware of the concept of toxic stress and adverse childhood events being a predisposing factor for actual physical health problems like lung disease, etc., later in life. But there's a lot of work being done on this interplay in humans. But as I said, until relatively recently, this is something as a veterinary profession we've kind of ignored. And then along came Tony Buffington and his group at Ohio State and started talking about it in connection with idiopathic cystitis in cats. And from that point, people started to actually think about it, but it tended to be, oh, that's that disease that's got stress in it. It's like as if it's unique to FIC. The FIC is the disease in which there's a stress component. And that clearly is not true. It's just one example. It happens to be the one that hit the veterinary research literature and people started to take it seriously, even though people have been talking about this for a long time. So physical and emotional health are inextricably linked, and it's bilateral. So if you have physical disease, that's a risk factor for emotional disorders, and if you have an emotional disorder, that's a risk factor for physical disease. And as I say, in humans, we know that physical disease affects mental health. So if you have, for example, elderly people with low mobility because of things like arthritis, that can have an effect on their mental state through affecting their potential to engage in things like social behaviour. So that this is a complex relationship. And also if you have things like depression or anxiety, that you are more prone to certain diseases, particularly things like IBD, I'm sure you're familiar with. So other diseases that have been shown to be correlated with mental health. So for us, what's important is that rather than ignoring this, we need to consider it when we're doing our normal everyday general practice veterinary work. So this is not something that's just for specialists. Certain vets like myself have actually specialised in emotional health as the thing that is our primary concern, but that doesn't mean that we're not involved with physical health, because you cannot do one without the other, just where your predominant interest lies. And there's your archetypal FIC cat, usually presenting with maybe physical signs like periuria or hematuria, but also may present with things like over-grooming of the lower abdomen. I'm sure you've seen those in practice. So a mixture of different signs that they may be presented with. But it's very important to consider emotional state when we're looking at feline diseases, obviously canine as well, but we're talking about cats today.